I want to move to a question now that's sort of, I guess there is a perception, I think, fair to say, among some CFOs, perhaps some other folks in the healthcare C-suite. They look at workforce and they see it as a cost. So the question I want to ask each of you is, how can a CHRO, what advice do you have for a CHRO who's trying to work against that perception and maybe stop seeing workforce as a cost and seeing it as a strategic tool, a strategic lever to pull and think about? Tomya, begin with you there.
Yeah, so I think it goes to, Brian made the point earlier about storytelling. It really goes to being able to connect people to the revenues and the outcomes and not just focus on the hearts and minds. And yes, the hearts and minds of people really do drive a healthcare's culture as well as any other business's culture, and they're the most critical component. But without people, there will be no healthcare delivery. And without people, there are no patients. So I think that there's a moment, right, for the table to be set with, we recognize that we need people to deliver this. And so, yes, there is a cost to having them here, but the question is, how do you make the most out of that cost? And I think that there's an opportunity to really connect both vacancy rates, patient satisfaction back to people. There are data that show that where you have a high level of patient satisfaction, it connects directly to there being a high sense of belonging in patient care teams. And those teams only have a high sense of belonging when they feel cared for by their organizations. So I think there's a real connective moment for CHROs to take not only patient sat data, but their turnover data, their attrition data, and connect it directly to patient revenue and patient outcomes, and for CFOs to be able to understand that without one, you don't have the other. And so how do you really have an honest, driven conversation about that in a way that supports the value proposition of those health systems, as well as the culture that they're trying to deliver?
Focusing that conversation on the patient, kind of what I'm hearing is helps open their eyes to all the humans involved, because you get, to your point, Tomya, great patient care can't happen without great teams.
Yeah, I think it is to both sides. And I think there's a point where everyone has to, around the table, recognize that, yes, people are a cost. And the question is, how do you leverage that cost to give you the greatest outcome? And so that's also where I think you start to, and Brian mentioned this a little earlier, where you start to leverage technology. Where is the greatest value with the human component of that? And how do you use technology to take on the places where the value to both the system and to the patient has a lesser impact?
Brian,
I'll add to that. I'll add to that too. Yes, there's definitely a cost. I think what it boils down to is, and I can speak this from a physician recruitment and placement side of things, those outcomes, those patient outcomes, should equal revenue, right? They should equal billable opportunities. And I think if you look at it through the lens of, yes, there's a cost associated, but there is a positive monetary outcome based on that too, particularly that CFO who is looking at that bottom line, but connecting the dots on the positive attributes of the care that's provided, the impact to the community, tying it directly to the revenue that's being generated, is a piece that needs to be connected. Again, back to the goal and backing into that, what those outcomes should look like. So yes, while there's an added SG&A and coming to your bottom line, you look at that being offset by the revenue or the EBITDA that's being produced on the other side of the fence. And if I'm a CFO, that's what resonates. I think, again, connecting that together to show that the whole dichotomy of the relationship and the impact that the HR team can provide is really, really a holistic view that would resonate with that C-suite.
Yeah,
and just to add, if I could just add quickly, I think that it's easy, to Brian's example, to focus on the revenue producers of the people side of the equation, but there are a number of people that are needed in order to make the system work that aren't going to be fully connected directly to revenue. So a physician is directly connected to the administrative assistant that supports that physician, and also the patients that are connected. won't be seen as a revenue producer, but it's an enabler. And so we really have to make sure that we are focusing on the whole system that provides care and what that means and how do you connect those pieces and not just focus on the direct revenue pieces, because that's an easy place to get stuck and not realize the value that the supporting cast, if you will, of a healthcare system provide that are also important. So I want to make sure that we don't over rotate just on the revenue production side, because it's easy, I think, to do that, but we don't think about the culture of care that needs to be in place in order for patients to even select a health system. And so that's the part I think that we also have to focus on, is that people have choices as it relates to healthcare delivery. And if the experience isn't one that they want to repeat, then they will choose to do something else.